Hi, thanks very much for the opportunity. My question was, I work for a charity and we're looking at thinking ahead to services getting back to normal or a new normal in the NHS for our patient group. What do you think the role of national bodies like NHS England should be in leading us out of this crisis and getting services back to normal? And what do you think the role of local health systems should be, particularly concerned about existing inequalities and differences in services across the country being compounded, basically? Thank you.
Thanks, Freddie. I think I will probably finish by going back to where I started from. I think the role of the NHS is in treating this disease, and actually our new normal, if our new normal is to be a normal that we all want and want to embrace, then we need to prevent this disease, and prevention is the remit of public health system. We're quite passionate about public health in Liverpool. We have one of in fact, the first public health chief medical officer, William Henry Duncan, who was appointed, post Irish famine. And we've had a long and illustrious history of it. And it's been quite depressing, I think, over the last 10, 15 years to see how Public Health England has been systematically defunded, underfunded, and reconstructed and tinkered with, such that when this pandemic hit, it was not best placed to deal with it from a public health perspective. In the absence of a vaccine, I'm normally a very optimistic person, but for a variety of reasons, I think we should not pin our hopes on a vaccine coming anytime soon. In the absence of a vaccine, then this virus will continue to circulate. It will continue to wreak havoc. It will continue to have disproportional effects on a regional basis, particularly in areas like Liverpool, which have a hidden morbidity anyway. And therefore, it is absolutely intrinsically important that we actually have a bolstered local public health system for for testing and tracing. The tenets of public health, the basic tenets of public health, are what will help us manage this outbreak in the longer term. And public health is best done regionally, because we're all one village. We have no borders in a pandemic, but this disease has actually exaggerated the differences that we have within our country. We are a diverse people with very diverse health needs, diverse health outcomes. And public health is local. It's based on trust, it's based on local knowledge, and it's based on local resource. And so what I would like to see coming out of this is a recognition that we need to invest significantly in public health and get it back to where it used to be. The countries, as Hugh said, we suspect as medics that the countries that have done better haven't done better because they're any better at managing the consequences, the medical consequences of this virus. It's a horrible disease. It wreaks havoc, and we're treating it with the same drugs, whether you're in Germany or the UK or Ireland. But those countries that will get back to the new normal faster are those countries with really efficient public health systems, where they've invested and where they've got that running like a well-oiled machine. And we're an island nation. We've got many advantages. So we should be able to pivot to a public health system with adequate resource that helps us get on top of this. But that's going to require investment at a regional level, and it's going to require regional voices to be heard.
Thank you. I'll jump in there. So I have to say, Louise says so many things that I would say as well. The first thing I would say is, let's, in the issue of what we do locally compared to nationally, let's let government nationally set destinations, not routes. I think it's perfectly reasonable to say what the expectation is for delivery and preservation of health, but it will be different in Liverpool from North London and from North London to Central. And I think let's let localism decide what the route to the destination is, because they're often much better at determining it. Secondly, I could not agree more. The National Health Service is not a national health service. It is a national disease treatment service. And if outside COVID, you came to my intensive care unit on any day of the week, 14 out of 15 patients in those beds on a smaller unit are there due to public health failure. They're due to lack of exercise, poor diet, lack of access to clean air, poor education, drugs and alcohol, all of the things that are affected by poverty and iniquity. And if you sorted those things out, you could sack me and get rid of me, because I wouldn't have very many patients at all to deal with. And the same is still true of COVID. It is not hitting people equally. It is hitting the poor most for a bunch of reasons, including their comorbidities. So I absolutely would be reinvesting heavily in public health. And I would take that in a much more broad fashion. And I would include the environment. The fact that 176 people were boarding a jet plane every second around this world was a recipe for spreading a virus around the world. And it's not like we didn't see it with SARS-1 or with MERS either. It's just this got a higher R value that's made it more lethal. So we've got to start thinking more broadly about the way we treat our planet, how we manage our food, what our taxation policy is to protect our environment upon which we depend, because bear in mind, we all die from climate change in the next 60 or 70 years anyway if we don't get this right, and then start protecting public health as a priority rather than very expensive high-tech care at the far end. And finally, you said as a summing up, I mean, I would say a huge thank you. And I think the thank you goes not just to my health worker colleagues, the nurses in particular, that step up to the plate, and are the frontline workers outside that support us all. But my thanks to the general public who've lost their jobs, who've borne that with tolerance. I'm paid to do a job I enjoy, and they have none. I'd say a big thank you to the people of the country for responding to lockdown as they did. If they had not responded, we would have been absolutely swamped. That's why Nightingale was being built, because people didn't think the British public would respond as valiantly as they did. So massive thank you to them. And actually, picking up on Louise's point from the beginning, I will say a thank you to our political leaders. They may have their failings, may have made mistakes along the way, but I don't doubt that whatever the party political colour of people in charge, that they were trying their best to do the right thing. It may have got it wrong for a bunch of different reasons, and that's much easier to point to in retrospect. So I think we should just remember that no matter what the party politics, they've had a pretty tough war as well. So a thanks to everybody for that.
Okay, just to draw a few of those threads together, I think this has been, the learning of this is a public health issue in the broadest sense. Now, legend has it that 80% of everybody's health is economically driven and 20% on the healthcare that they receive. Now, we're focusing in this pandemic on the really acute stuff and the really sort of high intensity medicine. The effects of this go all the way back to the economy and life chances and, social circumstances, jobs, environment, proximity, travel and all the rest. I think we got to start attending to the really unsexy stuff at the end of this, and it's got to be, the instead of the acute medicine end of it. It has been denuded. Local authorities have been trashed in their funding, and they cannot do what they need to do. I think it's time to get back to some of the really unsexy stuff. The local versus national bit, we've got to do something about that. The social contract here is at risk of being dismantled. The trust that people have in the systems, and the lockdown and the response has been great, but we need to rebuild that social contract in some way, and participative democracy and participation in the systems of government has got to be part of that. I think it's a much bigger issue, and there's far more at stake here than just the healthcare system. I think it's a far bigger issue. Hugh's mentioned the environmental aspects. And we need to retain some of the good stuff we've got in that one, the wins we've had. And the answer for me to that one is not more control and more centralisation. It isn't even more coordination. It's about trust, and it's about stitching society back together again. Now, if there's a long haul in anything, it's that.